today? I trust you good. Happy International Nurses Week to every nurse out there. God bless you real good, because you've got the most loving hearts. God bless you. God bless you for all you do. God bless you for the care you show to the world. God bless you real good. Yeah, still on the health awareness creation. You have Miss Mary on the show today. Today, actually, we have a very interesting topic to discuss. Assisted reproductive technology, ART. So when you hear of assisted reproductive technology, I believe what comes to your mind is the most available, which is IVF. Yes, you're right. IVF is one of those technologies aimed at achieving pregnancy. So I believe you enjoyed the video of yesterday, which was on harmful reproductive practices. So this topic today is going to be supporting that, backing that topic up. So what is infertility? Because all of these are encapsulated in infertility. The reason why assisted reproductive technology is necessary is because of infertility. And World Health Organization defines infertility as a disease of the reproductive system, defined by a failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse. And please mind you, when you hear infertility, the man shouldn't come to your mind, the woman shouldn't come to your mind. Infertility, as research shows, is 30% female factor related, 30% male factor related, and 40% related to the unexplained causes of infertility. You know, certain cases of infertility are just unexplained. You get to the hospital, you go through all the investigations, your wombs, your tubes, the sperm cells are checked, analyzed, but there's no reason for infertility. Nothing abnormal is seen, yet conception is not possible. So we shouldn't go on the blame game, blaming either the woman or the man for infertility. Okay, so today we are not going to have a lecture. We're going to be rather answering some questions, those questions that pop up on your mind when you hear of IVF. Like, what really is it? Where is it done? Do we have it in this part of the world? Is it not only in the Western world? How much does it cost? I believe it must be very expensive. Will the babies look like me? Will they be normal babies? Yeah, those are the questions and many more we're going to be tackling today. And we can't take on this topic without giving credit and acknowledgement to the first IVF baby, in the person of Louise Joy Brown, born on the 25th of July 1978, to Mr. and Mrs. Peter Brown. Yeah, Louise Joy Brown was born in Oldham General Hospital in the city of Manchester, England. So we acknowledge you, the first IVF baby, and that is also to show you that IVF is not a magic. It's not some magic. It's not some fake thing. It is real, and it's not going there to be given somebody's baby. It is pure science, genuine science. Okay, so let's go. Okay, so what is ART, assisted reproductive technology? Assisted reproductive technologies include all treatments that involve the handling of eggs and or embryos. Now, talking about eggs, we're talking about the eggs a woman releases about the 14th day of a menstrual cycle that needs to meet with the husband's sperm cell to form a baby. Yeah, and let's talk about the most common assisted reproductive technologies that are available to us. IVF. We also have IUI, which is not as cumbersome as IVF. Yeah, but let's talk about IVF. IVF is in vitro fertilization. That's the abbreviation for in vitro fertilization. IVF is, it just has to do with fertilization done outside the body in either a laboratory dish or a test tube by the embryologist. So the embryologist brings the egg and the sperm together to cause fertilization and then the formation of an embryo. So now, what is the aim of ART, assisted reproductive technology? The aim, the sole goal of assisted reproductive technology is the provision of safe, efficient, and affordable care to optimize the chances of conception and the delivery of healthy babies. And recent studies have focused, recent studies in ART, assisted reproductive technology, has focused on the achievement of this goal through biochemical and genetic researches. Okay, so now let's delve into certain questions about IVF. Okay, so you have to note that your fertility journey begins with hooking up and seeing a fertility practitioner. Yeah, that's when you can say you have started your fertility journey, not alone but with your spouse. And now, so why do we need to talk about this? We just have to answer these questions because these worries even prevent people from meeting a fertility practitioner, from going into the fertility center, because they have some unanswered questions and they just make assumptions or believe rumors that the negative side is the answer to their question. So let's answer this question so that you know that you just need to speak with a fertility practitioner. Okay, so number one, what is IVF? That's one of the questions we are faced with. IVF is what I have explained previously. It is an assisted reproductive technology. It is aimed at the achievement of pregnancy. And IVF comes in because conception is not happening spontaneously. So you need the assistance of a well-trained and licensed team to assist you with your fertility and reproduction. Now, people also wonder, does it work? Like, what's the success rate? Now, the success rate of in vitro fertilization depends on age and the cause of infertility. The younger a woman is, the more likely you are to get a success with IVF, So, and research shows that below 45 years of age has about 50% chances of conceiving with IVF. However, the chances reduce with age and also the cause of infertility. Okay, so another question that comes up is, will my babies look like me? Will they look like me? Yes, of course, your babies will look like you. Of course, it's your egg. It's your husband's sperm. Your babies will look like you. Now, on the aspect where you use a donor gamete, like maybe a donor egg or a donor sperm, yeah, then you can expect some attributes from the anonymous donor. However, a good fertility team will take it upon themselves to properly cross-match, such that you have some traits from you taking on this baby, like your height, your complexion, and all of those phenotypic properties. But just know that your baby won't be a stranger, okay? Yeah, so another question is, what if I'm told I have clocked menopause? Or what if I have clocked menopause? What if my husband can no longer ejaculate or something? Yeah, in vitro fertilization, that is where the case of egg donation comes in. If you've clocked menopause, besides, different people have different ages at which they attain menopause. Menopause is not one fixed age like 45, like 40. Yeah, so you'll still be subjected to some investigations. Your follicles will be checked and things will be checked. But if you have clocked menopause, there is an option. There's the option of using a donor gamete, an anonymous donor gamete. So with IVF, you still can have children even though you've clocked menopause. Over the years of my practice, I have witnessed women who have clocked menopause, who are postmenopausal, but got a successful IVF cycle. Yeah, and for the men, if you think you no longer can ejaculate, there's also an option for sperm donor sperm. Yeah, you get sperm from an anonymous donor. Trust me, this is not on you, this is on your clinic. Your doctor will take you through everything you need to know during your IVF process. Another question is, can I have a baby boy if I want a boy? Can I have a girl if I want a girl? Yes, you can. So there's provision for something called sex selection. Yes, certain fertility facilities provide that too, sex selection. So though it will attract an extra charge, yeah, but you can actually have a baby boy or girl if you want. You just need to pick up that option of sex selection. It is still through IVF. The question that comes up is, what if I don't have a womb? Some people don't even ask. Some people just assume that, and of course it is thinkable, right? You don't have a womb, so I think your own is over. No, it's not over. If you don't have a womb, probably you've had a hysterectomy or something has led to the removal of the womb, and you know you do not have a womb. Still, you can have children. There's another option called surrogacy. Your fertility doctor will take you through everything you need to know. Just step into a fertility clinic and you get all the information you need. So surrogacy involves a third party who will be the carrier of the baby. Yeah, your husband's sperm will be used. An anonymous donor egg from an anonymous donor will be used, and then fertilization happens, but the baby is transferred into the womb of the surrogate mother. This surrogate mother is in some countries anonymous. In some other countries, there's no issue with the commissioning parents, that's the original owners of the children, knowing the surrogate mother. Yeah, but there's just an option called surrogacy that you can explore if you do not have a womb. I've come across a lot of couples that have had children from surrogacy option. Yes, it can work. So not having a womb is not a death sentence. It doesn't mean you can never have a baby. You can have a baby through IVF. And then another question could be, how long does it take? How long does it take? I have mentioned earlier that it's time demanding. It involves a lot of stages, a couple of stages. Not like you're going to take 3 months, okay? A couple of stages. Yeah, it's actually time demanding. Yeah, so all you need to do is just hook up with a fertility specialist, and then you'll be on the right track. Another thing is, how much does it cost? This seems to be the greatest factor that scraps out IVF from the minds of people. People think it costs so much, but have you ever spoken with a fertility specialist? Have you ever spoken with a nurse? Have you ever spoken with someone? Have you ever stepped into a fertility clinic? Until you go there, you cannot know how much it costs. Yeah, I know in Naira, in some fertility clinics, you can have an IVF cycle with 950,000 Naira. Yeah, in dollar, it costs about, oh, not 950 in dollar now, but I know in the Western world, in some fertility clinics, it would cost about $12,000. Yeah, about that range. But trust me, in Nigeria where we are, it's with 950,000 you can have an IVF cycle, though not in every fertility clinic. Now, I know indirectly we've talked about where you can have IVF done. Of course, you haven't mentioned Nigeria, but let's just tackle it as a question. Where is this done? Some people are aware of IVF, in vitro fertilization, but I think they need to travel to somewhere very far. They need to board a plane, travel to the Western world to have it done. Trust me, Africa has gone that far to do in vitro fertilization. And right here in Nigeria, we have a couple of IVF centers. We have a lot of IVF centers. I'm not going to mention names, okay? But we have a lot of IVF centers. Trust me, you may be surprised you have one in your state and not so far from where you are. We have a lot of IVF centers in Nigeria, so you can actually have it done without having to board a plane or going overseas. So there are lots more questions to handle, but I'm just going to save the time right now. But please, there is going to be a Zoom meeting later in the day that you need to hook up with by 7 p.m. GMT. So on this Zoom meeting, you're going to have a lot of fertility experts where you can ask your questions and get real-time answers, okay? But finally, let's consider the question, how about my faith? Yeah, a lot of people are aware of in vitro fertilization but cannot explore that option because of their faith. They have certain cultural and religious restrictions. Okay, I'm just gonna say, I respect your religious restrictions, your religious perspective about IVF. I respect it, and I'll urge you to also respect your faith, your religious perspective about IVF. However, I wouldn't fail to mention that IVF is science. It is science. Just as we, like every other very simple things we do, it is science, okay? IVF is science. Like we go to the hospital to complain of one symptom or the other and we get drugs take and we are fine. IVF is science too. It's science, though in a higher form. It is nothing out of science. It is science, and we bless God for the knowledge. Okay, so I'll bring this to a close right now. Thanks so much for watching. Thanks for staying till the end of this video, and I would love to have you all at the Zoom meeting where a couple of fertility experts will be attending to more questions and even giving deeper understanding and more details about what we have tackled right now. Thank you so much, and a quick shout out, even as we close now, to every nurse out there. Happy International Nurses Week. Thanks for watching.